Good afternoon, everybody. Welcome to Monday. It's a start of another week. We hope people are finding ways to stay safe and healthy, finding ways to support their families and friends, and know that we get that this is a tough time. We again are here today to give you an update on what's happening in Eau Claire County related to COVID-19. And I'll quickly share a little status update, and then we can respond to some questions that you may have. In Wisconsin, as of today, there are 1,221 positive cases for COVID-19 from testing, an increase of 109 cases, and 14 deaths, one additional death since we last reported. Almost 16,000 negative tests have been done. Again, it's considered that there is community spread happening across the state, so certainly the numbers for the state of Wisconsin are only a small portion of the total number of people that likely have COVID-19 in our state. In Eau Claire, we have 11 confirmed cases, one more since yesterday. We also had 2 over the weekend, so 3 more cases since we talked on Friday. All of those people have had the follow-up needed, and we are checking in with all their contacts and making sure that those people are all staying home and self-quarantining. The individuals that are positive are, of course, home and not having contact with other individuals. 531 people in Eau Claire County have been tested for COVID-19, and 412 tests have come back as negative. We are not sharing gender or age-related data on any of our cases, but the state is. It's a big enough group of individuals that they are sharing that information, and that information is available on the state website. It's about evenly distributed based on gender and the normal kind of curve we would see based on age. Our call center over the weekend was open, and we did get calls each day. We continue to respond to calls about the order, about people having questions about testing, and people having questions about symptoms. So those continue to be calls that come in. We do encourage people to call the COVID-19 hotline. That call center number is 715-831-7425. And again, that's staffed Monday through Friday as well as Saturday and Sunday. So a couple of things that are reminders. If someone has symptoms that they think are COVID-19 related, please call your healthcare provider. If you think you need medical care, particularly call your healthcare provider. Again, we want people to stay home if they have symptoms, even if they're minor symptoms. We need people to stay home so we stop the spread of disease. Even minor COVID-19 related symptoms, people should not be going out to do essential activities like shopping and picking up medications. They should find someone else to do that for them. Testing is happening again for those high-risk individuals, those that are hospitalized, those that are healthcare workers or in long-term care facilities. People that have no symptoms or very minor symptoms will not be tested. Again, it's the judgment of the healthcare provider that results in a test happening or not happening, but the purpose of testing, especially given the importance of knowing what we have for spread in the community, is really to get those that are most at risk and make sure that treatment is appropriately done for those. Today, the governor announced a new public-private partnership to increase testing in the state. He indicated that they are planning to increase the number of tests statewide from about 2,000 a day to have capacity to be closer to 4,000 daily tests being done. That partnership will be rolling out, I'm sure, over the next couple of days, and I'm sure we'll see that impact here in Eau Claire as well. As increased testing happens, we likely will see more cases, so that should not be a surprise to people as that happens both statewide and in Eau Claire. We also know that nationally and internationally, there is a shortage of some of the supplies related to testing. So while capacity of the labs is increasing, some of the supplies are a challenge, and that may increase the ability to do, again, broad-based testing. That is why we are prioritizing testing in this state and across the nation for those most at risk. If someone doesn't have symptoms, if someone is being told to get a test just for work-related reasons, that isn't a reason, unless they're a healthcare worker, to be tested. So no symptoms, no test, I think is probably the easiest thing to remember. The governor also reminded the broad Wisconsin community about their work to get more PPE into the state, more personal protective equipment into the state, particularly for healthcare workers, to also work on getting other equipment that might be needed, and the state work around planning ahead when and if we have a larger surge for medical capacity needs. So those needs where people are hospitalized, they need hospitalized care, and making sure that we have places for that to happen. The more we follow the stay-at-home order, the less likely we will have issues with enough beds available for healthcare service provision. The stay-at-home order is critical. We do know that some people aren't taking it seriously, and the governor again reminded people that that is a public health method to flatten the curve, to decrease the number of people ill at the same time, and we need to follow that. In our work locally, I'll highlight a couple of things that happened over the weekend and are prioritized today. We are very much obviously following up on new cases and contacts to cases. Not only do we have cases in Eau Claire, but some of the people that are cases in other counties had contacts in Eau Claire. They may work in Eau Claire, they may have family in Eau Claire that they were in contact with. We work with all those people as well. That happened over the weekend. We also have a group that has been working since last week, but is upping their game this week around elections. We know that both for voters and poll workers, there are concerns about having safe and healthy elections. We are committed to that in Eau Claire County, and there's a team of people that's working on that as well. We also have an important team working on preparedness for hospitals. Tomorrow there is a weekly hospital meeting happening. We do that every week, and tomorrow that meeting is again happening with critical conversations around where is the planning happening for surge, again, for having more people in their facility, and what are their needs to make sure that their healthcare workers are safe and to make sure that they're ready for when and if that happens. Finally, we are tracking and looking at our personal protective equipment and other supplies that might be needed during this incident. So lots of work happening with things coming in and going out, as well as identifying what else might be needed. We are making sure that the order is followed. So a team of people is answering questions and complaints about the order not being followed in Eau Claire County, or questions about whether something is an essential business or not. We need all essential businesses that have been identified in Eau Claire to take seriously that even if they're an essential business, they need to make sure that their employees and the people that come into their facilities, their guests, are safe. We're counting on them also doing the right thing. Things like making sure there's physical distance between people is critically important. Making sure that they're screening their workforce, those people that are coming into their essential service, to make sure that they are healthy. Cleaning and hand washing, all of those things are critical. Our operations in the courthouse, for example, we are making sure that people, before they come in, are checking their temperatures. We're making sure that people are reviewing symptoms and not showing up if they are ill. We have a strict cleaning schedule. We have a strict way to make sure people have physical distance from one another. We expect all essential businesses in Eau Claire to be doing that. We likely will be more actively going out to essential businesses in the near future to be making sure that that's happening and supporting them and educating them on ways to do that in their business. But right now we're really counting that people in Eau Claire are doing the right thing. If there are complaints, we are absolutely following up on those as well. The same with individuals. We are counting on people following the order. There's a reason that the household is identified as the stay-at-home place. It is not just that you stay 6 feet apart from people. That is critically important, but going and meeting a large group of people at the park or at some social gathering or in somebody's front yard and staying 6 feet away is not the intent of the order. The intent of the order is to stay with your household, stay with your small circle right now while we're trying to protect spread from happening. We frankly would prefer not to have to respond to complaints. We'd prefer that there weren't complaints coming in, so we really hope people do the right thing and follow the order as the governor has laid out. Additionally, our incident command, the people that are working very directly on this are working with the other cities and communities to make sure that things are moving forward in Eau Claire across the county. Elections is a clear priority there, and making sure that safety is really focused on safety of all of our responders and all of our healthcare workers, as well as safety of our essential service employees across the community. Public information continues to be a priority. This time together at 3:30 will continue as long as we see it helping people learn about what's going on and as long as it's supporting us doing what we need to do in this community. We also have our Facebook page. Again, that is coronavirus.ecehealthdepartment.org, and the call center is a place that you can get additional information. So I would say to everybody that our message primarily today is please follow the order. Please make sure you are staying informed. Those people listening to this, you have a network of people that you can talk to about why it's important to follow the order. And please, if you are ill, stay home and make sure that you're protecting others in your circle. I think at this point I will respond to questions, and we can certainly close hopefully a little early today. Yeah.
Do you have any numbers on how things went over the weekend in regards to maybe number of complaints or any type of citations that were issued, stuff like that?
Sure. So the question was around complaints and how many numbers of complaints and how many citations. I don't have the exact number of complaints and citations. We have not, as far as I know, cited anybody over the weekend, but there were lots of follow-up activities happening. And certainly this morning when we had a fuller staff, there was activity out to a variety of businesses to clarify some things that we recently found out from WEDC about what were important places that were non-essential. And as always, we try first to go forward with an education message. Sometimes a business or individuals themselves don't know that there's an order or what the right thing to do is. Messages are going out to business through a variety of means, and that has helped a lot as well. I know this morning there were a number of questions about some of the essential services and whether a certain type of operation was essential, so that was definitely happening this morning. Yes?
Your reports say that the coronavirus is supposed to peak towards late April in Wisconsin. Could you just tell me how accurate those reports may be?
So there have been some reports that have been published recently around the peak of the coronavirus activity in Wisconsin. Some reporting April, some reporting May. There's been a variety of educated guesses about that. Built into those models, and we have not spent a lot of time looking at the details of the model that is talking about the end of April, are some of the things that help us think about how something like this will progress. We know that we are not at the peak of disease right now. The models that have been proposed at the state health department level, talked about the doubling of cases over 2 or 3 days of time for the next number of weeks, and that's the importance of this order that is in place now, is really giving space and time for there not to be disease transmission between people if they stay home. So there was intention around that 4-week order. It's possible that the peak will come in April, and it's also possible that in some parts of the state, because we are seeing things a bit differently, that the peak may come at different times. I think to remind everybody that Milwaukee and northeast Wisconsin and southeast Wisconsin certainly saw a large increase in cases much earlier than we did, and it is possible that the peak will happen at different times in different places, even within our state. Part of the order is to flatten that curve and to make sure that exposure is decreased during the time we're under the order, so that once the order is lifted, we can have less happening no matter where it is in the state. Other questions? Yes?
Has the county received additional PPE in recent days, and if so, what are they and how are they distributed?
Sure. So the question was, have we received as a county additional PPE or personal protective equipment? How is that coming in? How is that distributed? We have a whole team of people working on not only getting personal protective equipment, primarily masks, but other items as well, and distributing those. They're on a very strict prioritization of distribution, and we are very carefully looking at that. While many people want surgical masks and other types of masks, the recommendation is not for everybody to have those. We're not only planning for today's need, but we're planning for the need in 2 weeks, in 4 weeks, when that peak happens, so that our healthcare workers, those that are most urgently in need of PPE or masks, have those masks available. We did on Friday talk about the large donation from Xcel Energy of masks, and that was an enormous asset for us to have. There are donations coming in to the state stockpile of PPE, and the governor talked about that again today. But we know overall that, like other states and countries, we likely will not have enough. And our biggest concern right now is that we think ahead for the need, and we prioritize that PPE in places where it's most critical that we don't have disease exposure. Masks in and of themselves don't protect the average person. Distance does. This is a disease that is transmitted primarily by droplets, by coughing, by sneezing, and the distance, kind of a difficult thing to imagine, but maybe very visual, is as you sneeze and as you cough, how far does that go? You want distance between you and the person that might be sneezing or coughing. Those healthcare workers, those first responders that are in close proximity and doing healthcare services with individuals need the masks to protect them and to protect the people in their operations. Yeah.
Please get related to that question. Can you talk, and I don't know if you guys have numbers yet, but can you talk about the need versus what you have now? How big is the gap?
Yeah, so the question is for equipment, particularly masks, what's the difference between need and gap? We are still working through how to sort out need. There are some calculators out there, PPE calculators that are being utilized by the state, but they've just started. We found out about those over the weekend, and those calculators to estimate numbers are really being worked through right now. This is, again, not an institution by institution problem. We are really working hard that we don't have, for example, one hospital with lots of PPE and another hospital with none, or one provider with a lot and the other with none. We really need to approach this as a state and approach this as a community so that we're sure that in the riskiest settings, long term, we have available supply. It's a really important question. We're still working through that with the state, and I'm assuming that soon we'll have tighter numbers on that. There's also a lot of research happening around conservation of PPE, which is a strange word, but are there strategies that others have found where instead of a mask on and a mask off in between rooms, which would have been the way we would have done it in healthcare previously, we can keep people protected but have different ways to utilize the stock that we have. So those will all factor in to deciding how much do we need compared to how much we have. Other questions? Yes?
Kind of to build off of like the supplies, is there a number of how many hospital beds and ventilators that Eau Claire has access to?
Mm-hmm. So the question, again, related to supply and what do we have available when we may need them is related to hospital beds and ventilators. We're hearing a lot about do we have enough beds, do we have enough ventilators? We are fortunate in Eau Claire that we have 3 hospitals and 1 surgical hospital. We have 4 facilities that have beds and have available ventilators. Daily, those healthcare settings report in on their beds available and their resources available. So every day that happens, and available beds and available resources are identified. From that group, some of those are logical beds and resources for use during COVID-19. At this point in time, we don't have a gap. The hospitals and healthcare systems, one of the topics for the meeting tomorrow is based on what we have available generally for healthcare beds for this purpose and equipment for this purpose, specifically ventilators, what might we need given a couple of different scenarios? Worst case scenario down to, in general, we think about this percentage of the population might be hospitalized. Right now, absolutely no concern today with the illness that we have, but that is what healthcare is working through. They're gathering that data now, and they're having a collaborative conversation about that tomorrow. Yes?
At the State Hall, they mentioned voluntary isolation centers, those being considered here locally.
So the question is voluntary isolation centers. Again, that was mentioned on the state call and is something that we're actively working on locally. So I think I talked on Friday a little bit about the different facilities that we may need down the road. One of those facilities is for people that are ill but able to take care of themselves but can't be at home for whatever reason, as well as facilities that are for individuals that are self-quarantining. They're well, but they've been exposed and they need to stay away from others for those 14 days. Again, for people that may not be able to be at home for some reason. We have identified a variety of facilities for that purpose in Eau Claire. We are not currently utilizing those, but we have, again, a group that is working on that, and we have had lots of conversations about how that would be utilized. Some of the locations that the state is considering are for bigger purposes for self-isolation, and we're certainly working in concert with them as well if we need a bigger spot for certain types of purposes. Some healthcare workers, some emergency responders are interested in potentially having places where they don't have to return to their family if things get significantly worse than what they are right now. So we are aware of those situations, and we are in conversation to identify both larger facilities and those smaller number of rooms that might be available for those that don't have another place to be. Yes?
To jump back just quickly to the hospital beds availability.
Mm-hmm.
If I understand correctly, this year was especially tough regarding influenza. And I don't know if the season is lasting longer or not, but could that be a factor that could potentially limit the number of hospital beds available if and when this does get bigger? And I know that there's timing involved with that, right?
Yeah. So the question is, what's the impact of influenza and influenza hitting our communities on whether or not we have beds available and resources available to deal with COVID-19 when and if the numbers significantly increase for hospitalization? One of the positives about influenza is that it is typically a seasonal disease and different than what we're expecting right now related to COVID-19, which may hit later in the year and the waves may not be seasonal. Influenza typically is. So while we had a later influenza season, we are seeing numbers slowly decrease, and we would expect that over the next few weeks that would not be a significant factor in impacting beds available. It's not that it isn't at all, but it certainly is not as much of a concern as if this would have hit in February or March. Yes?
I have one more for you.
Yeah.
Some reports show that nearly 40% of Wisconsinites are at like an elevated risk to have complications with coronavirus.
Yeah.
Could you speak a little more on that?
So the question is really, how many people, what's the percentage of our population that might be at elevated risk related to coronavirus? Some reports are out that as many as 40% of people in the state are potentially at risk. We haven't yet had time to review the article that was sent out about that, but we can know from the data that we have available that the factors that impact the seriousness of disease most typically have been people over 60. We can come up with a count with that and a percent with that. And then pre-existing medical conditions, particularly lung disease and diabetes, are also particularly problematic. We do have a large part of our population that would fall into those groups, so it's not that difficult to come up with a percent. That's why we're doing this order. We wouldn't do the order if a very tiny percent of people were at risk, because then we really could get those people to stay home and be safe for a little bit of time while this was going through the community. We have a lot of people at risk because of the risk factors. It's not a small number. The state reported today that the newest death, I believe, was somebody under the age of 50. So again, while we have these risk factors, we have to remember that our job is to protect everybody. We can make a guess at who is most at risk, and we know that from the data. It's not an entire guess, but everybody is at risk of getting the disease, and we need to protect everyone. Yes?
I believe Chippewa County had said the other day that at that time they'd had 4, and that 2 of the cases had been people who had not traveled. Could you just reiterate that of the 11 cases in Eau Claire, are all of those individuals who've traveled out of the county?
Mm-hmm. So the question of the 11 cases that we have in Eau Claire, how are we learning about how they got the disease? Are they all people that have traveled out of the county? Not all of the 11 cases are people that traveled. We have some cases that are connected to other individuals that are cases, so we are seeing those close family contacts as well. So as we do the investigation, our most recent case today, we were still doing the investigation on, so I'm not certain of the origin of that case, but the majority of our cases, at least initially, were travel associated, yes. Other questions? Good. So thank you again today for being here. My reminder to everyone is to find something to focus on that is a positive today, and to remember that there are people working hard and to find ways to support them so that they can continue to do the critical work. To use your influence to remind others in your circles about physical distance, about hand washing, about staying home when sick. Many of you have circles of influence that are wide, and be brave and say, boy, that's not the right thing to do right now. We need to protect each other, so please do that. And if you have questions, please go to our website or call our call center number. We'll be back tomorrow to share an update again. Thank you.